Hello. Welcome. After I understand a certain individual was shamed on what he was wearing, is there anything you need to tell us, Mr. Varco, at all? No? Okay, so. Nice to see you, Bernie. It is Monday, March 10th, 2025. If I'm a little verklempt, it's like Roger Moe is sitting in our audience right now, and it's like I've never, ever presented a committee in front of the guy who was a majority leader for 100 years in the state of Minnesota. I think that's just nice to see you, Senator. What I ask people, we got a lot of bills on the agenda. If you guys could get through your everything, 10 minutes for each bill. If that's fair, we can then get out of here at 5 o'clock. If not, then someone's calling Mancini's and they're delivering it and you're paying for it, not me. So, and there was no payola in that advertisement that was done there, Doctor. But we have, if you look at it, there's 13 bills, including actually, we want to get to conversation members with Ms. Bailey regarding federal payment issue discussions and then some other bill issue stuff. So would like to be able to get to that if we can and have some conversation. So members, if we keep our questions to a minimum, that would be great. Maybe write them down and we can talk about them afterward. That'd be great. So let's do that. Everybody's in agreement? Senate File 1138. Dr. Senator Mann, change the outcome appropriation to provide opioid prevention and education. You have Colleen Ronnie with you and Megan Wagner. So the floor is yours, Doctor. Senator.
Thank you, Mr. Chair, members. In 2022, the CDC reported the most overdose deaths ever recorded in a single year in the U.S., fentanyl being the most common causative agent. So Senate File 1138 seeks to change that outcome by funding Change the Outcome, which is an amazing organization dedicated to educating students about the dangers of opioid use and emerging drug trends. The funding will allow Change the Outcome to expand its educational program to middle and high schools across the state. And I will let the experts take over, Mr. Chair.
Thank you. Colleen Ronnie.
Yes, thank you. Good afternoon. Thank you, Senator Mann, Chair Hoffman, and all members of the committee for allowing us to speak with you today. My name is Colleen Ronnie, and I am the executive, or the founder and executive director of Change the Outcome. I'm also a parent who has lost a child to the opioid epidemic. Sadly, I'm not alone. Thousands of Minnesotans have lost a loved one to opiates or other substances. Having the company of so many others who understand this unbearable loss does not bring me any comfort, but it has inspired me to work as hard as I can to prevent it from happening to others. Our son Luke was just 20 years old when he experienced a fatal overdose in our home in 2016. His addiction began in high school when he was prescribed opiates for pain after oral surgery and an infection that followed. As any parent would do, I asked myself where things went wrong. What did I miss? How could I let this happen? How can I keep it from happening to someone else? In the aftermath of his death, it was crushing to realize just how ill-equipped we were in terms of understanding the risks of even legitimately prescribed narcotics and how they can lead to substance use disorder and fatal overdoses. We had very little understanding, and Luke had even less. As awful as it was, the ignorance made sense. 10 years ago, no school district in Minnesota had curricula devoted to raising awareness or understanding one of the biggest health crises our state is facing. Too many young people have lost their lives because of that. In the months after Luke died, I connected with some dedicated people at the Department of Health, the FBI, and Hennepin County Drug Courts who shared my belief that we owe it to our kids to provide them with the information and tools they need to successfully navigate the ever-changing landscape of substance use. We worked to create a pilot program to deliver prevention education in 2 school districts. That quickly evolved into Change the Outcome. It was the beginning of a small but mighty effort that is saving lives. This school year, my team of 8 will be in more than 100 schools, and we have delivered programming to more than 110,000 students across the state since we began. We have been in hundreds of classrooms throughout the state, from the metro to greater Minnesota. It doesn't matter where they live. The students we see and talk with have been impacted in some way by substance use disorder. Many have parents or siblings who struggle. Some are struggling themselves. It is not uncommon at all for a student to come to one of us on our team after we've had a conversation with the class to share their personal experiences or ask for more resources. Unfortunately, the opioid epidemic is not going away anytime soon. Supporting youth and educators with relevant, fact-based, and impactful prevention education that is sustainable is the right thing to do. It is a fiscally responsible thing to do. For every $1 we spend on prevention education, $20 is saved in future costs related to substance use disorder. Again, for every one single dollar we spend on prevention education, $20 is saved in future costs related to SUD. Students in Hubbard County, McLeod, Grant County need this education and are just as vulnerable to substance use as those in Anoka, Ramsey, or Hennepin County. This appropriation will allow us to deliver programming equitably in all areas of the state. We're scheduled in 1 or 2 schools every single day until the end of the school year. For the first time since Change the Outcome started, we have schools on waiting lists. The appropriation we're asking for will allow us to serve more schools, educators, and youth in Minnesota. It will save lives. I'm going to let Megan, our Director of Programming, tell you more.
Thank you, Ms. Ronnie. Megan Wegner.
Good afternoon, Chair Hoffman, Senator Mann, and members of the committee. Thank you for the opportunity to testify today. My name is Megan Wagner. I'm the Director of Programming at Change the Outcome. I'm grateful for the committee's ongoing commitment to addressing these critical issues, and I'm honored to speak before you today. My career began as an educator with Minneapolis Public Schools before I earned my master's in behavioral health from the University of Minnesota. I have since worked as a licensed alcohol and drug counselor in various settings, including inpatient psychiatry at Hennepin Health, a school district in the South Metro, in both residential and outpatient treatment facilities. Over the past 20 years, I've had the privilege of working with Minnesotans from all walks of life, and those experiences have deepened my commitment to addressing mental health and substance misuse. One of the key lessons I've learned from my clinical work is the importance of early intervention and prevention. Many individuals I've worked with struggled due to a lack of crucial, factual information that could have empowered them to make safer decisions about substances. This is exactly why the work that we do at Change the Outcome and the work we're doing in schools all across Minnesota is so vital. From Bemidji to Champlin to Columbia Heights to Apple Valley, we're proud to serve nearly all of your districts. By providing young people with the knowledge and skills they need earlier in life, we can help them avoid challenges that many adults wish they had been equipped to overcome. This work is transforming lives. Our program, designed for middle and high school students, features our locally produced documentary, The Reality of Hope, which explores the challenges of substance misuse while highlighting the power of recovery and the potential for positive change. After the film, a diverse group of relatable young people on our team share their lived experiences while using evidence-based information to educate and empower them. What makes our program effective is its emphasis on recovery and the potential for transformation rather than relying on scare tactics. Research shows that fear-based messages often feel exaggerated or unrealistic to young people, which can create resistance rather than understanding. To measure our impact, we use pre- and post surveys. The data we collect clearly shows that our program is educating and empowering students to make safer, healthier decisions on topics like Narcan, Steve's Law, recognizing an overdose, and press pills. Student understanding increases 40 to 60%. Moreover, 95% of students reported feeling more informed about current substance use risks after the program, and 94% believe that others their age would benefit from it. Additionally, we frequently hear from students after panels in our surveys who share deeply personal and profound impacts of our work. One student from Pelican Rapids reported that it genuinely helps to have a program like this here, especially as someone who's experienced all of these things. We recently heard from a high school student who had participated in Change the Outcome in middle school, who shared that they had gotten injured during an athletic event over the summer. Having remembered what they learned from CTO, they advocated for an alternative to opioid pain medication with their physician. Before I close, I want to share 2 staggering statistics from this school year that underscore the importance of our work. 50% of students knew someone who struggled with a substance use disorder. And 31% of our middle and high school students in Minnesota report knowing somebody who has had an overdose. These statistics reflect not just trends, but the lived experiences of young people facing real dangers every day. Their stories matter. The need for prevention, education, and support is urgent. With your continued support, we can equip even more young people across Minnesota with the knowledge and tools they need to navigate a world increasingly affected by substance misuse. Together, we can make a lasting change. Thank you for your time and consideration. Together, we can change the outcome for so many across our great state.
I agree, Ms. Wagner, and you are changing the outcome for so many. Members, in your packet is this blue folder that I can help change the outcome. There's some really good information in there. Senator Abeler.
Oh, just briefly, it's a solid program, Madam Chair. I'm sorry, Mr. Chair. Thanks for bringing it forward. I'm just trying to be brief, but thank you.
No, I appreciate that. And I think with that, and Colleen, I actually, I sent your information to a guy named Clark Torgerson, who this is absolutely something that, so I mean, it's the rule of two here, you know, it's like what you're doing. So if you get a contact from somebody like that, then blame me, because that's what I just did.
Happy
so I appreciate everything you're doing, and thank you for bringing this bill. Senator, thank you. This is good. We'll lay this thing over. So thank you very much.
Thank you.
Thank you. The next three, I don't see, so Jim, do you want to go ahead and do yours? I don't see Senator Maye Quade was going to do the next three Fateh bills. So let's go ahead and move forward to Senate File 1689 and then Senate File 1177. Jim, are you ready to do that? If not, Glenn, are your folks here? Yeah? You're good?
Yeah. Yeah, so I'm standing in for this for Mr. Kupek.
Yeah, no, Robert
So, yeah.
Freeman, there's Freeman.
Yeah, so here he is. We're
Yeah,
good.
yeah.
And then we'll do the next one. And that'll be
There's
great.
one Freeman here, but I don't see the other Freeman. I don't see Matt Freeman sitting in his
So
chair.
the only
so.
one that counts, Mr.
It's
Chair.
Robert
is here
today,
right
so.
now,
Senator Abeler, thank you for sitting in for Senator Kubik on the funding increase for the regional and local dementia grants, and that is Senate File 1689. Senator Abeler,
Mr.
thank
Chair,
you.
thanks. I could go on at length about how good these are, but I think I'll just let Mr. Freeman talk in the interest of time. And actually, you find that probably more interesting anyway, so thank you.
Mr. Freeman, welcome back.
Thank you so much. Just give me a second. I was not expecting to be here for another hour.
No, you're fine.
Yay.
Good afternoon, Senator Hoffman and members of the committee. Thank you so much for the opportunity to testify on Senate File 1689, a bill that would increase the dementia grants currently administered by the Minnesota Board of Aging. Over 100,000 people in Minnesota have Alzheimer's disease or some other form of dementia. It's imperative we do more to increase awareness of dementia, promote the benefits of screening, increase the rate of cognitive testing in the population at risk for dementia, and connect caregivers and family and friends who are to education, support, and resources. We know there's much unmet demand for these resources, and so we are requesting that we increase the appropriation from $750,000 to $1.5 million a year to better meet the needs of these communities. I want to mention a couple of examples of how that funding has been used in the past. The first is the Faith Community Nurse Network of the Twin Cities, or FCNN. Memory screens are quick, simple tests that evaluate memory and other thinking skills that detect memory problems early on. Recognizing both the importance of memory screening and the value of offering them in a trusted community location, the Faith Community Nurse Network of the Twin Cities sponsors 16 whole-person wellness screenings in 22 and 23 in housing sites and faith communities that included a memory screening opportunity. A remarkably high 87% of people taking the wellness screen opted in to a memory screen along with their blood pressure checks and other tests. Project leaders of the FCNN believe their strategy of normalizing memory screens by embedding them to a short wellness exam and offering them at safe community sites with trusted healthcare professionals is key to a high number willing to take a memory screen. As part of its project, FCNN also hosted memory screening training referrals for its network of 400 nurse educators who collectively reached more than 200 faith communities in Minnesota. And then I'll just share one other example of how this money is being spent as well, and then happy to take questions. So the second one is the Kuchiching Aging Options. When you hear the term frontier, you probably think about someplace long ago and far away, but Minnesota has 7 counties that today count as frontier areas with fewer than 7 people per square mile. With 4 people per square mile, Couchiching County is such a place. For almost the past quarter century, Couchiching Aging Options, or KAO, has been the go-to resource for older people and family and friends who provide care to them in Couchiching County. Multiple grant awards have helped KAO fill a gap in dementia-specific needs. One of their most critical and growing needs is one-on-one support from KAO's certified caregiver consultant. She helps stressed caregivers find resources, learn coping skills, and find time for self-care. KAO's caregiving consultant can also help people with dementia and their care partners connect, learn about Alzheimer's and other dementia, create a support plan, and connect with community resources. In just the first quarter of their 2024 grant, their caregiver consultant has connected with more than 70 people seeking support. In talking with folks in the community, we've learned that this amount is not nearly enough to fund the needs in our communities, so we're bringing this bill to increase the appropriation. Thank you so much for your time today, and I'm happy to answer any questions.
Thank you, Mr. Freeman. Thank you, Senator Abeler, for sitting on behalf of Senator Kupek. Senator Abeler.
Well, do members have questions? I'll just make closing
Anybody got
comments.
questions? No, it's a need. I mean, here I'm sitting here having this moment like you had 10 years ago of knowing here's the need, and I'm glad we're doing this. We are highlighting what the needs are in Minnesota in front of this committee, because a lot of people need to hear that. You agree with me on that one, Senator Abeler. A lot of people need to hear what our unique needs are when it comes to, I don't know, our aging population, people with disabilities, and the poorest of poor, right? So this is one of those where we know, and I heard what you're talking about, Couchiching County. There's absolutely some wonderful stuff that's going on out there. So,
Thank you, Mr. Chair. And the idea of how many frontier counties? 7?
7.
I believe, yes, 7.
Wow. I bet Senator Utke and Senator Gruenhagen probably have some of those. But anyway, so that's really interesting, thinking about that as a frontier thing. And just to your final comment, this is the kind of thing that we just helps a lot of people just to keep it together. The world sees this committee as a lagoon full of like ton of money that's just laying around doing nothing, and it's really well spent. So, Madam Chair, or Mr. Chair, why am I doing that?
Twice now.
I don't know.
It's because I picked on Varco earlier. That's why, because he was picking on
revenge.
Bernie. So I mean, that's
So thank you, Mr.
You're
Chair.
just getting back at me. Thank
we
you,
can lay
Senator
this
Abeler. Thank you, Robert Freeman. We're going to lay this one over, and then is Alana Gallagher? Yeah, there she is. Come on down. You're the next contestant on Senate File 1177. Senator Abeler, Disability Services Technology, Advocacy Expansion, Grant Establishment and Appropriation. Senator Abeler.
Well, thank you, Mr. Chair, and got that right this time. Some of the pieces of legislation we're going to hear actually would save money if we could get around to doing them. Assistive technology is one of those. In a world where there's just not enough people to do the work and not enough money to pay the people we can't get to go to work, it's just begging to be used, and this is an effort in that regard. And you know, the future is this kind of thing, Mr. Chair. If we're even going to be able to, you know, persuade people that the money we spend is well spent, this is a good way to do it. And with that, I have an amazing testifier.
Ms. Gallagher, welcome to the committee.
Thank you, and good afternoon, Chair Hoffman and committee members. My name is Elena Gallagher. I'm the Executive Project Manager for the Innovation Grant at ARM, and thank you for the opportunity to testify in support of SF 1177. This bill strengthens Minnesota's commitment to older adults and individuals with disabilities by expanding access to assistive technology and remote support, empowering people to live independently, engage in their communities, and achieve greater self-sufficiency. As highlighted in the one-pager included in today's packet, the work ARM has already been doing in this space has had a substantial impact across Minnesota. To date, an estimated 42,280 individuals have been directly impacted by these efforts. The feedback we receive from lead agencies and service providers has been overwhelmingly positive. Training participants consistently emphasize the critical value of these sessions and request that they be offered annually to keep pace with evolving technology solutions and policy. However, funding for this grant is running out. SF 1177 is designed to ensure that we not only continue this highly impactful work, but to also expand it to reach additional areas, ensuring that all Minnesotans impacted by aging-related needs or disabilities have access to tools that enhance their independence. Why does this matter? Assistive technology and remote support provide individuals with the tools to live independently, work, and participate in their communities while reducing reliance on in-person care. These solutions ease direct care staffing shortages, prevent crises, and delay or prevent institutional placements, creating long-term savings for state-funded programs like Medicaid. By investing in these technologies and ensuring individuals, families, and professionals have the knowledge to use them effectively, Minnesota can improve outcomes, expand opportunities, and help more people remain in their homes and engaged in their communities, all while reducing long-term costs. So as you can note, key provisions in the bill are annual training for support networks, which expands on ARM's existing work by ensuring case managers, county social workers, and disability service providers stay informed about the latest technology solutions and policies, helping individuals and families make informed choices. We will also add expansion to education and employment supports. This equips employment providers and job coaches with knowledge of assistive technologies that help individuals secure and maintain meaningful employment. By partnering with school districts to train educators and staff on assistive technologies, we'll be able to advance their knowledge, ensuring students with disabilities have the tools they need before transitioning into adult services. We also have support for transition-aged youth. This bridges the critical gap between school and adulthood by ensuring continued access to assistive technology and remote support, preventing the decline in independence so often seen after high school. This includes educating caregivers and professionals on how to support evolving needs. In conclusion, SF 1177 is a smart, future-focused investment that builds upon proven, high-impact work already underway in Minnesota. By supporting this bill, we can ensure that Minnesotans have the tools they need to live independently, reduce reliance on costly services, and fully participate in their communities. I urge the committee to support SF 1177 and help build a more inclusive and innovative Minnesota. Thank you for your time and consideration.
Members, any questions? Thank you. Senator Abeler?
If there's no questions, I'll just, Mr. Chair, she mentioned smart and future-focused. A lot of stuff that we do here is reactive and try to survive and hang on for dear life. As we do not use what's at the cutting edge of innovation, we have programs that the software at the department is clunky. We have some kind of clunky systems with min choices. And now with this assistive technology, with AI coming along, I can imagine the anticipatory nature of what that might do to actually head off crises. That's the future, Mr. Chair. So this is that bill. So with that, it'd be nice if we could get it done. Thank you.
You know, it reminds me, Senator Abeler, if you remember, years ago, you were the chair, and Sarah Grafstrom, do you remember? You said there's got to be something about technology, right? And I think out of that conversation, the department ended up creating called a Tech for Home grants or something like that. That was in there. So I guess the thing is, as we're going forward, Senator Abeler, maybe help us understand, because this is something you're spot on. It's going to save money. But since we don't do dynamic scoring in the state of Minnesota, we can't prove that. So, but great, Bill. We're going to lay this over. Is that correct?
So, Mr. Chair, yeah, it saves money and it's better for the people.
Love it.
They're not clients, they're people, Mr. Chair.
That's correct. Thank you. Thank you, members. No questions. Let's lay this one over. Thank you, Senator Abeler. Members, we're going to now go back to our order. Senate File 2052, 2053, and 2168. Senator Maye Quade is sitting in for our friend Senator Fateh. Senate File 2052 is the Community First Services and Support Rate Modifications. Wes Bloom and Rick Varco, you want to come on up? The hope here is to lay this over for possible inclusion because of the work everybody's doing on it. So is Wes in the house? No, he's on Zoom.
It's on Zoom.
It's on the internet. Sorry. Thank you, Senator Maye Quade. Thank you, members. Senator Fateh is not with us today, so Senator Maye Quade is sitting in for him, and so I appreciate you doing these. So, Senator Maye Quade.
Thank you, Mr. Chair. I'm just going to read Senator Fateh's remarks so you can just imagine me much more handsome and taller. Okay, so Senate File 2052 is one you have seen for several years now, so I will keep my remarks brief. In 2021, the Minnesota legislature established a statutory rate framework for the Community First Services and Supports Program, which is replacing the Personal Care Assistance Program. My compliments to Senator Uckey for his work on the bill at that time. Unfortunately, with everything going on in 2021, the legislature wasn't able to include the portions of the rate framework that would have built in cost adjustments over time. As such, PCA and CFSS has remained one of the few static reimbursements in disability service systems. In Senate File 2052, we would add the components to the CFSS rate framework to support a data-driven method, cost-based reimbursement model similar to the one already in place for other like services that use the disability waiver rate system. CFSS reimbursement rates would be determined by collecting data on work experience, requirements, pay rates, and administrative costs. And with that, Mr. Chair, I will turn it over to my testifier on Zoom, Wes Bloom, to speak to the need for this bill.
All right, Wes, welcome. Can you, for the record, state your name?
Hello.
Go ahead.
Mr. Chair and committee members, can you hear me?
We sure can.
Oh, my camera is not working. I apologize for that. Thank you for the opportunity to speak to you today. My name is Wes Bloomy. I am a member of the Minnesota First Provider Alliance Board of Directors. The Provider Alliance is a statewide association of PCA, CFSS, and waiver service providers. I currently run Wild Rose Home Care in Marshall, Minnesota. As you all know, the PCA and now CFSS program serves roughly 47,000 individuals with disabilities and older adults living in their own homes across the state. PCAs assist with all kinds of daily activities such as mobility, transfers, bathing, toileting, dressing, grooming, and other routine activities. PCAs also work with people with very high needs, including individuals with significant medical conditions. PCAs are essential when it comes to limiting unnecessary hospitalizations and keeping people out of high-cost residential settings. Fortunately, funding for the CFSS services has long lagged behind the various other home and community-based services provided as part of the disability waiver rate setting system. For example, while CFSS services are currently reimbursed much lower than the nearly identical individual home supports without training, this has made it incredibly difficult for CFS agencies and individuals seeking to hire workers for themselves to recruit and retain staff. This disciplinary in reimbursement has also a disproportionate impact on communities of color. As of 2020, 61% of PCA recipients are Black, Indigenous, and people of color. 37% were non-English speaking. Whereas of January 2021, 63% of those receiving HCBS services reimbursed through the DWRS system were white, and only 11% receiving HCBS services were non-English speaking. In the recent years, legislators have worked with a coalition of advocates to implement a rate framework proposal that would use workforce and Minnesota market data to recognize the actual cost of providing CFS services, similar to the rate setting tools in the DWRS system. The core of the rate framework proposal was passed into law as part of the 2021 Omnibus Health and Human Services Finance Bill. I would like to thank Senator Uckey and Senator Abeler for their hard work during that difficult session. However, because of the need for immediate support for the PCA program at that time was so great, the legislature was forced to abandon the various elements of the framework that would build sustainability into the PCA CFSS reimbursement over time. Senate File 2052 seeks to reinsert those components into the framework. Specifically, the bill would rebase the Bureau of Labor Statistics data used to establish the rate each biennium to reflect wages paid for direct support services like CFSS in Minnesota. Review the competitive workforce factor every 2 years to determine the impact of the broader economy on wages in similar professions. Build in increases to the implementation factor in recognition that the current framework only reimburses CFSS providers 92.8% of the cost of providing PCA services. Index the client programming and supports factor to inflation to recognize the impact the broader economy has on providing CFSS services. Legislators have heard a lot this session about the impact that capping inflationary increases on DWRS would have on waiver service providers' ability to recruit, retain the staff they need to serve their individuals in their communities. I'm here today to remind you that PCA CFSS has zero cost-based increase built into the system and has struggled as a result. I know the state's economic forecast is difficult, particularly in the next biennium. I hope that Senate File 2052 reminds you how essential this service is and how hard we work with very limited resources to provide services to Minnesotans across the state. Thank you for your time.
Thank you, Mr. Blumey. Thank you so much. Rick Varco.
Chair Hoffman, members of the committee, my name is Rick Varco. I'm testifying on behalf of SEIU Healthcare Minnesota and Iowa. I want to thank Senator Fateh, Senator Maye Quade, and the chair for hearing this important bill. We have long supported measures to provide automatic regular increases for the home care programs covered by our contract, including PCA Choice and CFSS. We want it to be a floor, not a ceiling, but a predictable increase would create a stronger, more reliable program. I just want to flag two items that would need to be looked at if we were to do this in the future. First, whenever new money goes into our programs, workers want the opportunity to negotiate over that money. They have that right under PELRA. To make that work, the first increase should probably take place in an out biennium after it has been passed. That would give home care workers a chance to bargain over how the money would be used in our next contract. Second, the timing of any regular increases and when the amount is determined would need to work within the timeline of our collective bargaining process. We would need to know the size or amount of an inflationary increase before we started bargaining, but the increase itself would have to take place after we had a chance to settle a contract and the legislature had a chance to confirm or even increase the funding. That would mean we would want to know the amount of the increase sometime by around September of each even year. Our contract our contract negotiations with the state usually start in October of the even year and wrap up in January of the odd year. The rate increase would then actually take effect no earlier than July 1 of the following odd year so that it can be implemented as part of a new contract negotiated by home care workers in the state. We have shared these important parameters for the increase to work with our collective bargaining process with advocates for the bill, the Department of Human Services, and with many legislators. We share them now so that whenever this very good idea to improve home care services for people with disabilities and seniors all across the states gets close to fruition, we will be sure to incorporate them into the policy. Thank you.
Thank you, Mr. Varco. Members, comments, questions on that? If not, I think the role here, Senator Fateh, you're working with the former CA of a legislative, the other body that Matthew Bergeron in the group, right? Is that what it's working? So that Senate File 2052 be laid over. Senator Abeler, as we lay this one over, do you have comments?
Well, I think if we had more time, we could have a robust discussion on the rate methodologies, but maybe not. Thank you.
Oh, my God. Did you know there was the last time we had this conversation on rate methodologies was the basement of the Capitol. This was 13 years ago, and I believe there was a senator sitting in between two of us, and she looked at you and I and said she's never going to sit in between us ever again. Do you remember who that was?
It was not Julie Rosen.
It was not Julie Rosen, just to say. Senate File 2053, Direct Support Services Rate Calculations Statement. I think this one, too, members, we've been talking about this one for a while. This one's going to get laid over as well. Do you want to give us what Fateh has got for this committee?
Thank you, Mr. Chair. Committee, Senate File 2053 is also a topic you've heard Senator Fateh discuss in committee previously, and like the last bill, it pertains to the PCA and CFSS program. Last session, we had a significant discussion in this committee about PCA providers' historic concerns with how DHS calculates the MA reimbursement needed to fund the minimum wages required under the state's collective bargaining agreement. This was the show your math amendment.
Yep.
As it is before you today, the bill would require the Department of Human Services to account for the full value of the wages and benefits negotiated for when calculating the rate increase needed to cover any increases to any future collective bargaining agreements, and report back to the legislature how it calculated the costs of the contract. Since last session, a lot of work has been done to try and address some of the concerns, and as I understand it, this biennium's tentative collective bargaining agreement does not include a minimum wage increase, so the issue is less acute now. That being said, we still believe transparency going forward is useful, and in light of the busy agenda today, wanted to be respectful of the committee's time and not get too deep into the weeds. Matthew Bergeron is here on behalf of the Minnesota First Provider Alliance if there are questions. Otherwise, we are happy to keep this one short and sweet and lay it over.
Thank you, Senator Maye Quade. Members, this is a conversation that's been ongoing with our committee. It's still ongoing. If anybody wants to get in the weeds, we can bring Matthew Bergeron up. If not, I suggest we lay this one back over again. He's shaking his head. So we're going to lay this one over. Anyone? Nope. So Senate File 2053 be laid over for possible inclusion in the omnibus bill. Thank you. Senate File 2168, another Senator Fateh bill, assisted living service providers, direct care staff compensation requirements, exemption provisions. I believe you got John Sundergaard and Ken Bentz are joining you, and they're all in person.
Yes, Mr. Chair, may I move the A?
Real human beings. You got an A1 amendment
Yes,
too, don't
Mr.
you?
Chair.
So
Yep.
Senator Maye Quade has the A1 amendment. All those in favor say aye.
Aye.
Opposed, same sign. Senator Maye Quade, now it's in your form that Fateh wants.
Thank you. Mr. Chair and Committee, Senate File 2168 seeks to delay the application and clarify the scope of a statutory change the legislature made in 2023. As of January 1, 2025, all providers delivering services reimbursed under the DWRS are required to use a certain percentage of MA dollars toward the wages and benefits of direct care workers. This percentage varies based on whether it is a provider of residential services, unit-based services, or day services. The proposal was only brought forward midway through the 2023 session and not particularly well examined during the committee process. And speaking with various types of DWRS providers, I have learned of concerns that the new obligations in statute were determined using provider cost reporting data that many providers believe is too unreliable. Providers have reported confusion of classifying expenses and worry that a system intended to make DWRS rates responsive to real-world costs is now being used to impose mandates on providers at a time when Medicaid is facing unprecedented certainty. Simply put, it feels like a one-size-fits-all approach, which would disproportionately impact small providers and something we should take more time to examine. So as amended, this bill does three things. First, it exempts assisted living providers providing customized living from this requirement as they are licensed and reimbursed under different chapters of law than all other DWRS providers. It also delays the effective date of this change from January 1, 2025 to January 1, 2029 to allow for significant administrative and legislative engagement as to the impact of the requirement on HCBS providers. And last, it establishes a multi-year process for clarifying the cost reporting process in statute, collecting new and more accurate cost reporting data and re-examining the thresholds outlined in the 2023 statute. I would like you to look at the letters submitted to the committee signed by the Minnesota Home and Community-Based Services Provider Association supporting this bill. There's also a one-pager submitted by the Residential Providers Association of Minnesota, which lays out the problems with the existing law and the solutions included in this bill. And with that, Mr. Chair, I would turn it over to my testifiers who know 100% more than I do about this bill.
John Sundergaard, all the way from Brooklyn Park, Minnesota. Welcome to the committee.
Thank you very much. Chair Hoffman, members of the committee, my name is John Sundergaard. I'm the executive director of the Lodges, which has a location in Brooklyn Park, which has customized living settings around the metro area. I'm also a member of the Residential Providers Association Board of Directors. I appreciate the opportunity to testify today in support of Senate File 2168, which seeks to exempt assisted living providers from the 66% requirement under DWRS and delay the implementation of this requirement for providers until 2029 after further data and collection and a collaborative conversation with stakeholders. As a provider of customized living, I understand the intent behind the original legislation. However, the current framework disproportionately impacts small providers like myself and fellow members of RPAMN. particularly those who are unable to access housing support contracts to offset the cost of room and board. Further, without private pay residents, we have no way of shifting costs to meet these obligations. Additionally, we believe that the current statute is based on unreliable cost reporting data. All providers, large and small, have struggled to navigate the cost reporting requirements with minimal clarity or guidance. This leads to inconsistent and likely inaccurate reporting and data. It also does not account for the unique licensing and operational costs of assisted living settings. Unlike traditional home and community-based services, providers licensed under Chapter 245D, customized living providers operate under a different regulatory structure under Chapter 144G with significant additional costs, including assisted living directors, certified food protection managers, building and safety compliance costs unique to customized living settings. These costs are essential for compliance, service delivery, and quality of care, but are not considered direct care compensation under the current methodology. Additionally, we are reimbursed under a totally different statute, Chapter 256S. As a result, assisted living providers face unrealistic financial burden that could force closures or service reductions, reducing access to care for Minnesotans with disability and our aging population. As mentioned before, many small providers do not have access to housing support contracts, which Senator Fateh is also working to fix through Senate File 814. Without access to housing support contracts, providers struggle to cover overhead costs and their dollars are stretched even further. The proposed legislation ensures that Minnesota's residential providers who are serving aging Minnesotans and people with disabilities are not disproportionately burdened by a one-size-fits-all policy that showed up late in 2023 session and was not subject to significant examination by this committee. I urge this committee to support Senate File 2168. We must take the time to get this right and avoid unintended consequences that could harm the individuals these policies are aimed to protect. Thank you for your time.
Thank you, Mr. Sondergaard, for the reminder about how when we set this up, we're still having those conversations. So, Mr. Bentz, how are you?
Very well,
Where's
thank
your
you.
Where's your firefighting equipment?
No uniform today.
Thank you. Welcome.
Good afternoon, Chair Hoffman and committee members. For the record, my name is Ken Bentz, and I'm the Director of Research Analysis and Policy for ARM. We are an association of over 200 organizations providing services through the 4 disability waivers and supporting people in a variety of different living environments. I'm speaking in support of Senate File 2168 as amended. We understand that the Department of Human Services has the responsibility to gather and analyze data to maintain the various component values in the disability waiver rate system, make sure that they're at appropriate levels, and to ensure that service providers are applying the revenue appropriately, especially as it applies to the compensation of direct care workers. This is an important function to preserve the spectrum of services needed to support our most vulnerable neighbors, and cost reporting has been established as the mechanism to do this. In this spirit, ARM and other stakeholders in the disability waiver space have appeared before committees like this on behalf of service providers time after time over many years, seeking appropriate adjustments to the rates calculated with DWRS to allow those providers to be reimbursed at levels that keep up with the cost of doing business. As you can imagine, that became much more difficult during and after the COVID pandemic, and the sector has not fully recovered. At issue in Senate File 2168 are the compensation thresholds that were passed in the 2023 legislative session. You may be aware that these were never presented or debated in any committee in either legislative body, and instead were included in the final Human Services Omnibus Bill. We've been in conversation with DHS since they were passed to try to gain clarity on how the threshold levels were derived and how to express providers' serious concerns with the practical ability to achieve them. From what we have been told, the thresholds were determined through a quick analysis of aggregate DWRS claims data from the rate frameworks, which yielded percentages of service rates that applied to direct care worker compensation, to which DHS then applied discounts to arrive at the thresholds that are now in statute. One of our issues is that the providers will not be evaluated using that methodology, but rather by cost reporting data, whose accuracy and validity has not yet been proven. As far as I can tell, DHS has not submitted a report to the legislature on the progress and quality of the data collected since April of 2022. Through this bill as amended, we are seeking to delay the implementation of the compensation thresholds to allow DHS time to refine the cost reporting tool and determine reasonable thresholds based on thorough analysis of validated data using the same methodology that providers will be evaluated against. We also seek to require DHS to meaningfully engage with stakeholders and involve you as legislators in the development process to ensure that the reporting process and thresholds are fair and achievable. Thank you.
Thank you, Mr. Benz. Members, any conversations? Senator from Anoka.
Mr. Chair, why would anybody go into this line of work?
Yeah.
Thank you for all the people out there in service land. Thank you for doing this. I hope we can make it so they can stay open, Mr. Chair. So this seems like a reasonable thing. I hope the department doesn't mind it, and I presume it won't cost any money. So
Yeah, I was wondering the same thing, Senator Abeler. I don't think, it looks like you're going to get Human Services Finance draft legislation required to implement the commissioner's recommendations. I don't think there is there a cost in your guys' looking at it? Ken Benson?
Not aware of any.
Kyle? No, there is? No? Mr. Christie's saying no. Ooh, Kyle. Christie said no. You want to?
To the floor.
We have a conflict here. You're good? Elise is shaking her head. Okay, we'll figure this one out. I appreciate this work. This is really one. This shows the need. Here we are. We're talking about the needs. We have needs, and yet what's looming over us is people who don't understand those needs. You know, and they're saying, "Oh, we're not cutting services. We're just capping the growth." Well, we knew 13 years ago that this demand was going to be here.
Mr. Chair.
Mr. Senator Abeler.
Well, and just one of the comments that this came out of a conference committee somehow landed there. So there's a good reason to have all this stuff done out as more openly as we can. So,
Yes, I agree. Thank you. This is good. We're doing this. So thank you. Anybody else? Otherwise, Senate File 2168 as amended. We're going to lay this one over to the inclusion for the omnibus bill. So thank you, Senator. As long as you're up there, do you want to grab your next one?
1925?
Yeah, let's go. Senate File 1925, Essential Community Supports, Eligibility Modifications, Provisions, Essential Community Support Services Available, Expansion Provisions, Caregiver Respite Services, Grants Increased, Funding Provisions, and Appropriation. How's that one for you? Did that give Freeman enough time to get up here? And I noticed now, Robert, that the other Freeman in our life has joined us, decided to, enter the room. So,
Us Freeman's getting it everywhere.
Go ahead. The chair is yours.
Thank you, Mr. Chair. I'm pleased to present Senate File 1925, which would provide $4 million in grant funding for respite care providers and increases eligibility for Essential Community Supports Program, a state Medicaid program, which provides direct support to caregivers. Last year, I had the pleasure of meeting with Doug here at the Capitol, a gentleman who lost his wife to Alzheimer's. He shared with me how hard his experience was as a caregiver and the impact it had on his physical and mental health and the difficulties for people with the financial costs involved. Being a senator is hard work, but being a caregiver 24/7 for a loved one is truly one of the hardest jobs out there. And there are literally thousands of people in every Senate district in the state like Doug who need help. One of my dear colleagues, her mother-in-law is experiencing Alzheimer's, dementia, and the one person she doesn't recognize in the world right now is her spouse. It's the only person she does not recognize, and they live together, and he cares for her every day, and a lot of days she thinks he's an intruder. And it's really, really difficult, and that's why I'm bringing this bill. This funding supports an existing program that was funded in the last biennium with one-time money. And as we all know, respite care is an essential service that provides family caregivers with the critical support they need to continue caring for loved ones at home. By supporting respite providers with these resources, we help families avoid burnout, allow more individuals to remain in their communities rather than entering more expensive, intensive, and often new settings. You will hear shortly from two testifiers who can speak to the impact of this program and the continued need for these grants. And like you said, Mr. Chair, we've known for 12 years that our population is aging. We have arrived there. I appreciate the committee's consideration and look forward to the discussion.
Thank you, Senator Maye Quade. Robert Freeman, and then we got Tuesday Glover. I was going to be on
Senator, can
Zoom.
we do it the other way around? Because I think Tuesday has to get off by 4.
Sure, Tuesday.
And she is a
Thank you for having me.
Welcome.
Good day, everyone.
For the record, you want to give us your full name?
My name is Tuesday Glover.
Awesome, thank you. Oh,
You're
we
welcome.
lost her.
Again, my name is Tuesday Glover, and I am the director of the Culturally Responsive Caregiver Support and Dementia Services team, Minnesota, Wisconsin, and that's VOA, Volunteers of America.
Yeah, good place.
Volunteers of America is a nonprofit health and human services organization committed to serving people in need, strengthening families, and building communities. For 125 years, Volunteers of America has offered comprehensive range of innovative services and networks that respond to and evolves with the needs of the community and pursuit of its mission. The mission is to help people build hope, resilience, and well-being. Our culturally responsive caregiver support and dementia services team has historically focused on supporting African Americans and East African communities members through education related to dementia, offering memory screens and supporting caregivers. The stress and health impacts and costs associated with the long journey of caring for someone impacted with dementia often creates two or more people who are in desperate need of support. Our work supporting caregivers reveals the importance and impacts of offering respite care. Dementia is a fatal disease. This vicious disease can affect memory, executive functioning, day-to-day living, and decision-making. Those impacted by the disease will eventually forget their loved ones, their names, forget those they are, they'll forget things they want to eat. They will definitely need a caregiver. The caregiver journey can be stressful, and I've witnessed this, and self-care is vital. Studies show that caregivers are more than twice likely to experience depression when compared to non-caregivers. Self-care is essential for caregivers, yet the time of caring for oneself is usually unavailable. Speaking on behalf of my clients, our clients, caregivers, respite services is in a crisis. As a part of self-care, our clients are seeking respite services so they are able to go to the doctor, appointments, go to the dentist, and sometimes just going to get a haircut. The cost of respite is on average $30 to $40, and I think it may be a little higher than that right now, with a minimum of 3 hours, which is often unaffordable for the caregivers that are served in our program. Most of the caregivers are retired and did not plan financially for respite services. The Culturally Responsive Caregiver Support and Dementia Services Program has recently collaborated with the Volunteers of America. We have a volunteer program called AmeriCorps Seniors to recruit our volunteers to assist us with short-term respite for now, for our present clients so they can have respite services while the caregiver enjoys our dementia and brain health education classes. I ask that the state of Minnesota support Senate File 1925 to continue funding for the caregivers who care for older adults with dementia, and I'm gonna say younger adults. Here recently, we have had a high number of early onset. On behalf of caregivers, Volunteers of America in Minnesota, Wisconsin, and its Culturally Responsive Caregiver Support and Dementia Services Program. Thank you for your time.
Thank you, Ms. Clover. And thank you for reiterating the fact that the capacity, the fact that there's no supports there and that respite services are deeply needed. Again, highlighting a need, Senator Maye Quade. Thank you for doing that. Robert?
Thank you, Senator. I'll try and be brief because I think Tuesday did a really good job of kind of highlighting the work that they do. Across Minnesota, there's over 160,000 unpaid family caregivers, and those folks dedicate countless hours, often at great personal, emotional, and financial costs to support their loved ones. 2/3 of caregivers are women, oftentimes in prime earning years, and respite care is a lifeline for these families. Investing in respite care is not just compassionate, it's also fiscally responsible. By supporting caregivers and preventing burnout of caregivers, respite services help delay costly nursing home placements and reduce reliance on Medicaid-funded long-term care. Strengthening respite will ultimately benefit families, communities, and the state's budget. I also want to draw your attention to another part of the bill, changes to expand the Essential Community Supports Program. This is a program that provides caregiving services for individuals, but you have to be close to poverty levels to qualify, and less than 150 people are using it statewide. We think it would be a more useful program if we made more people eligible, and we're working with DHS on technical assistance to understand how feasible that might be. So for now, that's placeholder language. We urge your support for Senate File 1925 to ensure Minnesota's caregivers have access to respite services that they need to continue caring for their loved ones at home. And we have a day at the Capitol tomorrow, so if you do support it, please tell your constituents when you see them. I want to thank Senator Maye Quade for authoring this bill and our co-authors, Senators Abeler, Hoffman, Kupek, and Bolden. Thank you so much for your time and for all you're doing to help families impacted by dementia, and I'm happy to answer any questions.
Thank you, Mr. Freeman. Senator Maye Quade.
Mr. Chair, I think,
Senator Abeler's got a question, I think.
great. Looking forward to
Well,
it.
I'm just trying to remember, Mr. Chair, is this what started, did this start in 2011?
Yeah.
Essential Community Supports, there was a push to cut nursing home funding then.
Correct.
Governor Dayton, it was another crisis. He was going to reduce spending by 4% or turn out 15% of occupied beds, and different people put this thing together. It's $400 a month. Looks like the bill does a number of things. It increases the eligibility to 400%. A bunch of families, they wonder, what do I do for my husband? And they're a senior citizen couple on not a low fixed income, but not a big one. And this would give them a little chance to do respite and keep them out of a place. Just a question, is the, maybe Kyle knows or somebody, is this a forecasted program? Yeah.
Yes.
Okay.
Kyle, is that a yes?
Yes, this is a forecasted program.
Well, thank you. And Mr. Chair, with our lean money, this is the kind of thing, if we could do that dynamic thing, fiscal note, this actually would reduce the pressure. And I bet it's separable from the grants. If you just try to increase eligibility and cover respite, because respite is something that's really important. So maybe there's some way to finagle that, Mr. Chair.
Thank you. I wish we could, because you got 100,000 hours, if I heard that right, of unpaid volunteering, correct? Was that?
160,000 unpaid caregivers.
Unpaid, 160,000 unpaid caregivers. So you think about that times X, that's actually larger than 100,000 hours of unpaid care time, right, Senator?
225 million.
How much?
225 million.
You're saving the system $225 million, Senator Abeler, to that point. It's a $2 million, and there's some money there that I think you put on the tail. So this is, again, a highlighted need. And especially since we're capping or we're putting restrictions on certain nursing homes and assisted living facilities and home and community-based services, this would make sense, wouldn't it?
Yeah, Mr. Chair, I'm just thinking maybe the thing is scalable. If you added respite and didn't change the income level, that would be something. That would use whatever's there. That would help some families. And you could, there's just iterations. And you might ask if there's a fiscal note, if they could enumerate what those, like separating the respite addition and then how much the additional cost for raising the income level to 400%.
And what the difference would be on that one at the scalable
Maybe there's a way to buy
conversation.
respite with your lean budget.
You want to look into that, Senator? That's actually, as we're having our conversation.
I think a chair can request a fiscal note, Mr. Chair.
I think I could request a fiscal note for that. Well, you can request a fiscal. Would you like to request a fiscal note?
Sure. Mr. Chair, I believe that Robert testified to this. I think because of the asset limits and the tests, I think there's only about 150 people who are using the program as it is, which is why we've changed some of those criteria.
Wow. Senator.
But just, then as you add more people, then they charge you for those. Anyway, this should have been more used. It's forecasted. If they would have shockingly used it more last month, it would be free. All that increased use that people would know.
Would have been free.
But if you add a service, then you have to pay for that. Thank you, Mr. Chair.
And in some instances, this committee's had to pay for something twice or three times, if I remember right? Senator Maye Quade, thank you for once again bringing something to us that we need to really have a conversation about. I appreciate that. I think we're going to lay this one over as well. Is that correct?
Thank you, Mr. Chair.
Thank you, Senator. Let's go back to our order of business. Senator Seeberger, non-emergency medical transportation payment rates increase. You got Scott Isaacson on the internets and Philip Stahlberger, who is actually all the way from Carver County. You coming up or are you just going to hang out? What are you going to do? Well, I always say Carver County with you. That's okay. We got you in Dakota County, Phil. That's good. You're going to have Scott go first then after you're done, or you want to go to Phil? How do you want to do this? It's all on you there, Senator. Welcome. Is this your first time to our committee?
No, Mr. Chair, I was here earlier this session on something, I forget what it was.
That's right, because you didn't bring donuts the first time either, did you?
No, I did not.
What the hell? I mean, this is just like, all right, what happened to the donut piece? Isn't it somebody coming in here? Is there like something we're supposed to have as donuts, right? Oh, that's the house? The other body? Oops, sorry. Now I'm in trouble. Welcome, Senator.
Thank you, Mr. Chair. To answer your question, when I'm done teeing this bill up, we'll have Mr. Isaacson testify and then Mr. Stahlberger contribute as well. So my bill, Senate File 2125, will provide for a Medicaid rate increase for non-emergency medical transportation services statewide. 90% of these services are provided through Medicaid, especially for our most disabled, our long-term care residents, and hospital discharges. A strong non-emergency medical transportation infrastructure statewide is important to assure appropriate medical transportation is available. Without a solid base of non-emergency medical transportation providers, ambulances are often used to transport patients back to skilled care facilities and other appointments, and that in turn doesn't allow the ambulances to be available for an emergency call, especially in rural smaller communities, and I can attest in the metro as well. This is something that I do quite frequently. It gives me great pleasure to speak with folks who are not in an emergency medical crisis and to whom I'm just providing transportation back from an appointment or something, but it does tie up the ambulance when we could be used for other emergency calls. The non-emergency medical transportation providers have also experienced a significant delay in doubling of the cost for vehicle insurance and the purchasing of vehicles. In this bill, there is more funding provided to lift assist, or what in the industry is called wheelchair vans. With the cost to purchase, staff, and maintain these vehicles, they continue to have limited access across the state. And with your permission, Mr. Chair, I would turn it over to Mr. Isaacson for some additional testimony.
Scott Isaacson, welcome to the Human Services Committee. Can you state your name for the record?
Thank you. My name is Scott Isaacson. Can you hear me okay?
I can, yes. Everybody hear him?
Very good. Good afternoon, Chair Hoffman and members of the committee. I appreciate this opportunity. My name is Scott Isaacson, and I'm here to testify in support of Senate File 2125, seeking to increase the Medicaid rate for non-emergency medical transportation services in Minnesota. I've owned and operated a non-emergency medical company for 16 years now, and I currently represent the R80 Transportation Alliance, which is a group of outstate NEMT providers. This is the 5th time I've been allowed to testify here in the last 5 years. I appreciate that. Sadly, in that time, several of my peers have left the industry due to lack of adequate funding. Considering this, SF 2125 is absolutely critical to maintain a network of providers to serve outstate Minnesotans. The need for our professional services doesn't go away, but it continues to grow. A Department of Health report published last November stated that Minnesota's population of 65-year-old and up, that in that age group is going to more than double in the next 50 years. So we really need to do something about this. I'm going to state 4 points of reasoning that this bill is so crucial. The first is Medicaid dependency and rural challenges. Minnesota NEMT providers serve the most vulnerable populations, including elderly and disabled, long-term care residents, opioid treatment patients, and unaccompanied minors, among others. A robust NEMT infrastructure is critical in rural areas where transportation options are extremely limited. Rural clients face significant barriers in accessing timely medical transportation to their care appointments, making the support of NEMT services essential. Currently, ambulance services, as we mentioned earlier, are making up the gap in NEMT service. That's particularly costly and problematic in rural and small communities where emergency services are already stretched to their limits. Second, as everybody knows, we've got rising costs and inflation, and as NEMT providers, we're facing significant challenges due to that inflation. The cost of vehicles, the purchasing of used vehicles, maintaining vehicles has all skyrocketed. For example, used car prices have gone up over 40% in the last couple of years. These financial burdens are making it increasingly difficult for NEMT providers to operate sustainably and hire qualified people, and I underscore qualified people. This bill addresses those issues by providing additional funding for transporting and purchasing the vehicles to support NEMT. Number 3 is inadequate reimbursement rates, and this is one we've heard over and over again. But since 2010, NEMT rates have only risen about 10%. What service could survive given a 10% increase in a 15-year span? Senate File 2125 outlines specific reimbursement rates that move us toward fair compensation for the services we provide. This includes adjustments based on the mode of transportation, geographical area, with higher rates for rural and super rural areas. I would also strongly advise at some point to incorporate an inflationary factor to eliminate us constantly having to revisit this issue. Number 4, finally, NEMT is actually a cost savings to healthcare, and it saves lives. Non-emergency medical transportation is not merely an expense. It represents significant cost savings. A study conducted by Florida State University demonstrated that NEMT more than pays for itself by reducing expensive medical services. Even a small percentage of NEMT trips preventing ER visits and long hospital stays can lead to substantial savings for our state. NEMT ensures that individuals, especially those with chronic conditions, can attend regular medical appointments, leading to better health outcomes and fewer hospitalizations. This proactive approach to healthcare management results in a positive return on investment. By facilitating access to lower-cost medical services, NEMT helps avoid complications and costly treatments, ultimately benefiting the entire healthcare system. In conclusion, Senate File 2125 is a necessary step to support and strengthen the NEMT infrastructure in Minnesota. By increasing the Medicaid rate for those services, we can ensure that our most vulnerable residents have reliable access to medical transportation, even in the most rural reaches of our state, and they deserve it. Thank you for your time and your consideration. Please support this bill.
Thank you, Mr. Isaacson. Good to see you again. Your
Likewise.
backdrop, I'm jealous. So we're looking at time limits on that. So 10 minutes, he pretty much got to the heart of what you're doing. So you want to go, Philip, and add to that? If not, from MTM, you want to give us an update? What do we need to know?
Sure can.
Thanks.
Thank you, Mr. Chairman, members. My name is Phil Stahlberger from MTM, Medical Transportation Management. Agree with everything Mr. Isaacson said. Won't duplicate that. We'd love to work with this company, and frankly, we understand that because rates are so low, many of them can't afford to. We used to have about 60 transportation company providers in our network. We now have about 40. Some of them just can't do the business anymore. We operate in 45 states across the country. Minnesota is the only state that puts our rates actually in statute. So you're an anomaly. So having said that, MTM works with 17 counties in Minnesota. We're doing 55,000 trips a month. And we're having fewer and fewer transportation providers available that can actually stay in business to do this work. So it is, as Mr. Isaacson said, completely imperative that we do something, and we believe Senate File 2025 is the right way to go if you decide that changing the model in the governor's budget isn't. So happy to stand for any questions.
Senator Radke.
Thank you, Mr. Chair. And two testifiers touched on it somewhat.
Yep.
Or did I jump in front of somebody?
No, I just put my fingers up as there's 4. All of a sudden there was like, you started and it went right down the line. It goes you, Maye Quade, then Abeler, then Gruenhagen. So
Okay.
that's why I was only doing the 4.
Sounds good. But just a further, just a question. I think we all understand the dire needs. But the rate increases that are in the bill, I heard Mr. Isaacson say something about, he covered some of the different reasons why, but wondering how'd you really arrive at them? And in the end, from the providers, is this enough to get you out of hot water? And then I'll throw it all into one. Mr. Stahlberger, you mentioned you do business in 45 states. How do we compare to some of the others around us, and what do we need to do to get up to where we got something that's sustainable?
Do you want to go first?
So, Senator Radke, you want Judy? You want to do the first thing first, or do you want to go to Stahlberger on the second thing first and the first thing last? What are you thinking?
Mr. Chair, they can handle it however they like.
I love it, Senator. The table's yours.
Thank you. In terms of the rates, Senator Radke, as you know, Medicaid does not even come close to fully reimbursing the value of services that are provided. When we look at, I think Mr. Isaacson mentioned that in the last, since 2010, the increase in rates has been about 10%. So these increases represent a modest increase in the cost, which I haven't done the numbers, but likely will not even come close to fully reimbursing the cost of these services, but will at least make an effort toward providing them with reimbursements that are closer to the costs that they incur by providing this essential service. Mr. Seeberger?
You know, Senator, I think the question is, there's, you know, the 17 medically mandated services in the state of Minnesota, right, Senator Utke? We look Medicaid mandated service. Medical transportation is one of those, right? Is this fall into that? Philip's shaking his head yes. Does this fall into that? Just like hospitalization, inpatient, outpatient is one, nursing home is one, medical transportation is one. Does this fit in that bucket, to Senator Utke's point?
Mr. Chairman, Senator Utke, I believe it is. Prior to 2019, this benefit was a federal rule, and it became federal law, so it would be one of the required benefits.
The answer is yes. It's one of those 17 Medicaid mandated services. Thank you for that. Senator, Phil, you want to keep going?
Yeah, Mr. Chairman, Senator Utke, how Minnesota compares, the model that we have in Minnesota is frankly very unique. In all of the 45 states that we're in, Minnesota is the only state that does it this way, which is county by county, or letting the managed care plans do it. I can tell you in the state of Wisconsin, which we operate the entire state of Wisconsin, both managed care and fee-for-service, we're doing roughly 120,000 trips a month. And I can tell you, rides in Milwaukee or Madison are a lot different in cost compared to the more metro or non-metro parts of Wisconsin. Same with Iowa. We run all of fee-for-service in Iowa and managed care. And, you know, I'm coming from maybe a Medicaid director standpoint. If you want to know how many exactly trips we're doing in a given day and where they're going, how many we missed, I can tell you both of those states could answer those questions in about 30 seconds. If you ask that question here in Minnesota, it would take a lot longer to figure out because you'd have to go to all the counties to ask that number, and you have to ask the health plans their number. So from an operations standpoint, we're doing it very inefficiently, in my opinion, which is why I testified last week on the governor's budget, and the governor actually changes the model to what almost 40 states have across the country.
Senator?
Thank you, Mr. Chair, and thank you very much. We're unique and inefficient. That's all I needed to hear.
Yes, non-emergency medical transportation is a mandatory benefit for Medicaid beneficiaries, so it is one of our mandated services. Senator, are we going to Jordan and then to you, Maye Quade, or we're going to you first? Senator Maye Quade.
Thank you, Mr. Chair. I think I support the more efficient way of doing it, and I'm wondering if, how do all the other states set their rates? How does that happen if it's not in statute?
Thank you, Mr. Chairman, Senator Maye Quade. Short answer is, including in the new proposal here in Minnesota, every state allows us as the manager of the program to negotiate with transportation providers. So we would negotiate with Mr. Isaacson on what the best rates would be. Clearly Duluth in the northeast part of the state is different than, say, Otter Tail County or southwestern Minnesota. So it allows us to look at what does the market look like and where do we have more providers versus less providers. Some states do allow us to use different modes of transportation, which help bring the cost down. So it really depends. You know, there is no apples to apples comparison from rural to metro. But by and large, we are allowed to negotiate with the transportation providers.
Oh, good. Senator Abeler.
Thanks, and I know we don't have time, but Senator Seeberger, this is the friendliest committee in the legislature to this topic. This committee has passed more rate increases to NEMT than any other one and actually tried to get them to work. We're still not giving, what, 10,000 rides a month to people, something like that. We got the sideways buck nod there.
I saw Buck's nod. It was sideways.
But it's like, that's over 100,000 rides a year to something. And it's not just for going to get your nails trimmed. It's like for dialysis and even blood transfusions, Mr. Chair. And so, I don't know, I believe that, so the governor may have an idea about the restructuring, and at this point, I'm pretty flexible. It's not working, but I can tell you the governor's numbers do not work. This is about a 50% increase or so, which is the rate you have to be in to get people to come back and do it. Forever, the department, I'm not here to bash them necessarily, but they keep having just a bad idea. If we cut the rates, somehow it's magically going to give more rides. And so if this indeed saves money, Mr. Chair, we're back to that dynamic fiscal note. So thank you.
I'm a big supporter of that. Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, thanks for bringing this bill forward. The if they didn't have these services available, they'd probably have to use an ambulance, correct?
Mr. Stahlberger, Judy?
Thank you, Mr. Chair. Senator, yes, they do use an ambulance, and I can attest as a paramedic, many times I am called on to give someone a ride from the hospital back home or back to their care facility. And again, I love doing it. They're some of my favorite patients. They're not in any kind of crisis. We have great conversations on the way back, but it is not the best use of me as a paramedic or my ALS ambulance to do that.
And Senator, Mr. Chairman, Senator Gruenhagen, in addition to transportation providers, you're also using the emergency room more. So even if they can get to a service, instead of getting to dialysis or other treatments, if they can't get there, they'll end up in the emergency room or worse off in the hospital for a lot longer. So there is an ROI study, which I will forward to staff, that shows it's almost a 3-to-1 ratio. You save money on NEMT compared to what you'd be spending in the emergency room.
It's like, yeah, facilitate access to healthcare services. The state Medicaid programs are required to provide necessary transportation. And you know, sometimes, Glenn, that includes an ambulance, which is going to cost twice as much, to Stahlberger's point. So yeah, it'd be nice to see how much we actually, do we pay the bill on that then? Does the department have to write a check to the ambulance providers?
I'm sure they do.
Oh, well, maybe we should ask for a fiscal note on that. So I don't know.
The next thing you know, you're back to dynamic scoring.
Yeah, I think this committee could pass it right now.
A lot of the
Glenn.
bills that you've been hearing, if you had dynamic scoring, you'd actually show savings. You know what I mean?
Now you're getting human services, Glenn. I'm so glad you wanted to be on this committee.
Well,
What's
I
your
had
next-
a bill to go to dynamic scoring, but they couldn't get it through the legislature.
You
But
do
that's
it.
another story.
What's next, Glenn?
Okay, next, just other question. Do you see, if this were approved, do you think there would be additional individuals entering the market to help you?
Mr. Chairman, Senator Gruenhagen, I sure hope so, because we want to have, I mean, transportation providers are the backbone of NEMT services. So the bigger of an increase, the more likely we're going to be able to have companies that are willing to do it. So I would say, I can't say every transportation company would come back into the market, but I would say they probably would if they can recoup their costs. And this is in the right direction.
Thank you. Members, this one makes sense. We're at it. I want some dynamic scoring bills. Be laid over for possible inclusion into the omnibus bill. Is that what everybody's agreement is? So be it. Thank you, too. Thank you, Senator. Next time, bring the chocolates. All the way from Hermantown, Minnesota, Senator Hauschild. Is this your first time in front of us?
Mr. Chair, just here last week.
Do you guys believe that? Senate File 1948, Senator Hauschild, Critical Access Nursing Facilities, Increased Funding Appropriation, CANF, one of our favorite things to talk about. And
It is.
works. And you got Adam again on Zoomage?
I do.
All right, so Senator, it's all yours. Can you do this in 5 minutes?
I can, I think, Mr. Chair. Thank you so much, and members. Today I have for your consideration Senate File 1948. This bill appropriates an additional $2 million for the Critical Access Nursing Facility, CANF program. In 2023, the CANF program was revived and was provided additional ongoing funding for both 2023 and in both the 2023 and 2024 legislative session. Prior to the implementation of the value-based reimbursement in 2026, CANF was used to provide relief to qualifying or designated nursing facilities. Following the implementation of the value-based reimbursement, it was determined that VBR should fully cover rural nursing facility rates and that CANF program was temporarily suspended. The CANF program was restructured following the devastating impact of the COVID-19 pandemic on nursing homes and related market changes. DHS designated the selection criteria to preserve access to nursing facility services in isolated areas and improve quality. A selected nursing facility will sign a memorandum of understanding and receive the program benefits for up to 2 years. The adjustment is included in the external fixed rate. With the additional funding in 2023 and 24, the updated base funding is $3.165 million per year or $6.33 million in the biennial. The pre-2023 base funding was $1.5 million per year or $3 million in the biennial, but the CANF program, as I mentioned, was suspended. According to DHS, 20 rural facilities received CANF funding in the 2023 and 2024 sessions. We must ensure financial support continues to be offered for isolated nursing facilities like those in my district, and that is why, Mr. Chair, I have Adam Maslowski from our Boundary Waters Care Center again this week for this bill.
Welcome back, Adam. The internets are yours.
Thank you, Chair Hoffman. Again, I'm Adam Maslowski, Administrator up at Boundary Waters Care Center, and I appreciate the opportunity to testify. The Critical Access Nursing Home Funding Program has been hugely beneficial to Boundary Waters Care Center. My nursing home was faced with closure approximately 2 years ago. At the time, the facility was still struggling with the aftermath of the financial challenges associated with the COVID pandemic. During that time, resident census declined and workforce issues became extremely strenuous and costly. A plea was made to the community of Ely through a fundraising effort to keep things afloat while legislative solutions were pursued. The community of Ely stepped up and over $60,000 was raised in order to keep operations going. It was just enough to get us to what actually saved Boundary Waters Care Center from closure, and that's critical access nursing home funding. Our care center applied and was accepted into this program, with the result being an increase in yearly revenue of approximately $400,000 per year. Last year, the care center's net operating income was just $200,000. Without this additional funding, we would have operated at a loss. Our facility is unique in that it is completely standalone nonprofit, simply run by a local board of directors who are volunteers from the community. There are hardly any nursing homes in the state that operate this way. Most are owned by a conglomerate or some large entity that they can fall back on during tough times. We don't have that luxury. We are alone. We're also one of the most rural skilled nursing facilities in the state. Ely is an aging community. Time and time again, I hear from the families of our residents about how happy they are to have a facility such as ours in the community. I walk into the lunchroom on any given day and see dozens of family members having lunch with their loved ones. They are on their own lunch breaks, and due to the facility being right in town, are able to do this. It is an amazing benefit to our residents' psychosocial well-being. The next closest facility for our type is almost 50 miles away. If our facility wasn't here, these family members would have a 2-hour round-trip drive to see their loved ones. These are people that lived and worked their entire lives in Ely and want to stay in the community they had been a part of and made into what it is today. In addition, the core group of staff that I have working for me have a ton of ownership in the care they provide because they truly feel and are literally taking care of their neighbors. In my mind, having a nursing home in Ely, despite the challenges faced from being so rural, is a definition of what CANF funding program is for. So I implore you to support this bill because it helps Boundary Waters Care Center so much, but I also believe it to be important for every other critical access designated facility in the state. Providing health care in the rural areas of the state is hard. It's hard for everyone, not just us. I happen to be close with the administrator of the Frazee Care Center, Patrick Craigie. They too have benefited from the CANF funding. I spoke to him after finding out I had the opportunity to testify. I wanted to hear how he felt CANF funding had impacted his facility. He was quick to say one thing, and that was, I don't know what we would do without it. I'm certain that this sentiment would be echoed by each and every one of the facilities that are currently designated as critical access through this program. I don't know what adding $1 million in funding in each of the next 2 years will exactly do for Boundary Waters Care Center. I don't know if it will mean that we will receive a larger piece of a larger pie, or if it will simply mean that additional skilled nursing homes will be able to take part in the program. To me, it doesn't matter. Either one would be a win. My passion is caring for older adults. My passion is making sure that they are cared for in the communities that they contributed to all their lives. And whether additional funds help my own nursing home or another, That is what truly matters, giving these rural facilities the resources and chance to keep doing this and keep caring. Thank you, Chair Hoffman, for your time.
Thank you, Adam. Nice to see you again. And absolutely, CANF, members, this committee, 2 years ago, we funded CANF. And last year, we gave money to it because we knew that isolated the impact that it was going to have. And here you're hearing that. It's just, again, a unique need for our Minnesota seniors. And we responded to that. This committee did that. Actually, the CANF law was established, I believe, by Senator from Anoka in 2021, if I remember right, after when it was, all the work was done on it, and then we finally got the ability to fund it in 2023, and now you get to hear the impact it does. So, Grant, I wish you could ask, maybe, we're being told that we got to do a little hair trimming on $1.5 billion, but we're not cutting services. We're just, we're going to cap the growth here. So help us understand that, right? I mean, there's a deep need the state of Minnesota has. The most affected are elderly, which we knew, right? 12 years ago, the silver tsunami was on its way. Well, it's here. This is an impact. Not only to that, but the most vulnerable in the state of Minnesota are right there in Ely, Minnesota, which the Blueberry Festival is all for you. And then I appreciate you bringing this back to us. And Senator Utke.
Thank you, Mr. Chair. I'm going to have to get a supply of pencils, and I can just throw them at you to catch your attention.
You're funny.
Anyhow, thank you. I got a question. And the testifier, hopefully, is still on the Zoom there, but Mr. Maslowski, he just talked about this $1 million per year and how important that would be to their operation, but does he have the figures in front of him? I know all of our long-term care and nursing facilities have recently gotten the number of what the proposed governor's budget reductions would be. And I'm just wondering if he has that and could share and how that, I mean, we're looking here at $1 million. They're probably
night and day difference,
reducing that much from them too, just to kind of know where the lay of the land, so to speak.
Mr. Maslowski, do you know offhand what did you send in those numbers? What it would mean to Senator Utke's point? The proposed.
I didn't send those in, but I do have them, and over the course of the next 4 years, it ramps up each year to result in just over $1 million just for our facility reduction in funding.
Senator Utke.
Thank you, Mr. Chair, and thank him for the answer there. Yeah, that just shows, I mean, we're looking at this, but 25% of it would be taken away if we can't change that proposed reduction in reimbursement rates.
So $1 million loss, Senator Utke, you could probably be guaranteed that place would no longer exist up in Ely, don't you think? Is that
Well, he was telling us how important this $1 million per year was to keeping their operation alive, but yet 25% of it would go away with the proposed reduction.
Yeah.
So yeah, it makes it tougher and tougher to do business and serve the citizens of that area.
Thank you. Thank you, Mr. Maslowski. Help me, Grant. Help our committee. We need some. It's like I was talking with the agent friendly, and I said, "Stop being friendly. It's time to get angry." So, maybe you could help us, find that passion. But I appreciate your passion and your work on this. So, any final departing words?
No, Mr. Chair, I would just say that I think there are storm clouds on the horizon, right? And we see this at the federal level as well with Medicaid cuts. And I think a lot about representing the rural communities that I represent. Yep. And I think what a lot of folks don't realize is that when we cut these government programs, whether it's state or federal, it impacts rural communities the most.
Yep.
Because we are more reliant on Medicare and Medicaid. We're more reliant on equitable funding and education.
Yep.
We don't have the tax capacity that other suburban and urban places have.
Yep.
I'm not saying that there aren't challenges in other places, but I will tell you that my rural communities will face the biggest threat from what's happening at the federal level, and I'm concerned about that as well.
Well, then help us find the answers. Thank you so much.
Thank you.
With that, we're going to lay this thing over, and then we're going to go the Senate File 2144, then Senate File 70. Look at Senator Putnam. Come on up. You got Aaron Fisk, President and CEO of Catholic Charities, Diocese of St. Cloud. So welcome. You're going to do your senior dining program thing. You're going to have
Mr. Chair. I do want to say,
you're going to have the old Iron Ranger Duluth guy come up too, or is it just going to hang out?
This is for us.
It's all
I do
yours.
want to say thanks. It's great to be in front of this committee again, and I'm saying that because I've never been in front of this committee before. Apparently, that's a theme today.
It's just welcome to Human Services. It's just, this is a collaborative thing up here. We have disagreements all the time, but we actually enjoy the work that we do because it's real. So talk to us, Senator.
And I appreciate that, Mr. Chair, although you did not collaborate at laughing on my joke, which is a little bit frustrating to me, but I'll get over it.
Did you, your wife's like a superintendent of schools, right?
Yes.
Your wife is like, my wife told me, look, you're not funny, don't try to be funny. So I just don't even try to be funny. So did she ever tell you the same thing?
Mr. Chair, she's so busy that she's never had a chance to tell me that I'm not funny.
Thank you. To your bill.
Thank you very much, Mr. Chair and members, for hearing this bill. Thank you for hearing Senate File 2144 today. It's a bill that's not only important to me and my own personal committee or for the 14, my own community or the 14 counties that are served by this program. It's important for all seniors in the state of Minnesota that they know that we're standing up for them and that we are supporting them. We're all acutely aware that public funds invested in the HHS budget are scarce and that we should understand that the future holds a lot of uncertainties around the availability of both federal and state funds. This is not a tremendous or giant ask. But we also know that people in our communities are struggling, especially those on fixed incomes like seniors. As you will hear, Catholic Charities Senior Dining Program was cut this year, and as a result of those cuts, 108,000 meals will not be served. 108,000 meals will not be served. Just take a moment to think about how much hunger, how much isolation that's likely to cause. This bill simply restores that funding to prior levels and allows the program to continue appropriating $420,000 in each year of the next biennium. While this bill will restore a great program and most importantly make sure our seniors don't go hungry, it is also an opportunity to support philanthropy and public-private partnerships to harness the good that occurs in collaboration. I'd now like to turn it over to my testifier, Mr. Aaron Fisk, President and CEO of Catholic Charities of the Diocese of St. Cloud, to provide a few moments of explanation of the concept in the bill.
Thank you, Senator Putnam, and thank you for driving all the way down I-94, Aaron Fisk. Unless you took Highway 10. Did you take Highway 10?
No, I took 94.
Well, you should have taken Highway 10 because then you could have gone down, beautiful town of Ramsey all the way through Anoka and then Coon Rapids and worked your way. But welcome.
Well, thank you, Senator Putnam, Mr. Chair, and the entire Human Services Committee for your time today. Again, I'm Aaron Fisk, here to discuss senior nutrition. And as you, Mr. Chair, talked about the silver tsunami 12 years ago, that's what we're discussing today. We have a contract through Central Minnesota Council on Aging to serve 14 counties. We have 3 different delivery methods for our senior dining. We do congregate dining, Meals on Wheels for those homebound, and then frozen meal distribution, which came out of COVID for those who didn't really want to leave their homes. We served over 350,000 meals last year to over 5,250 individuals. And Mr. Chair, you talked about serving the people who are elderly and low income. That's what this program does. And so why am I here? As Senator Putnam talked about, we received significant funding cuts last year. Talked about 107,000 meals, $420,000. The program was also in the red before the program cuts, and those dollars from the Central Minnesota Council on Aging were the largest component of that program in terms of dollars. And as Dawn Simonson from Trellis AAA and Jason Swanson from Minnesota River AAA testified on February 19th to this group, those kind of funding cuts have real significant impacts on providers and their ability to deliver services, and we are no different. And so we were forced to close some sites and reduce the number of meals, as Senator Putnam talked about, especially for the frozen meals distributions. And given the long-term budget outlooks for both Minnesota and the federal government, we need to adapt. And so that's why we're here for these dollars, is to really talk about the Title III dollars that make up the most part of the senior diner funding are very restrictive in the current methods and approaches that you can do. I saw this firsthand when we were working with one of the small communities where we had to change the site model and the community was really concerned. We didn't have a lot of options to work with them on. It was kind of an all or nothing.
And that didn't make a lot of sense. And so we're at a point where we need to think creatively and pilot some alternatives if we're going to do this long term. And so some examples of some alternatives, we're thinking about some meal kits so that local churches or nonprofits can cook the meals, more frozen distribution options, partnering with local restaurants to do partial supplying of the food, potential online cooking classes where in the rural areas that people can get together and actually online cook the meals from meal kits together from someone teaching them, school partnerships where they're already making meals, and mobile food shelves. We're going to have to think about this from a different region perspective because each community is different. But it's also, Senator Abeler talked about a lot of the work being reactive and trying to hang on. We're trying to be proactive in this, seeing what's coming down the road and creating some other models. So prior to being at Catholic Charities, I've been there about 10 months. I spent 20 plus years in the for-profit, from industries from wholesale retail distribution to med device and life science. And in those industries, you had to innovate to survive, and senior dining is now in that spot. And so we're looking at the funding to be able to look at different models, come back and say what worked, what didn't, and what we can use to scale across the state. Thank you for your time.
Oh, thank you. Members? Senator Maye Quade.
Thank you, Mr. Chair. Thank you so much for coming in. I love food, and I love when people get to eat. I'm chief authoring the senior nutrition bill this year, and I'm just looking at these numbers, and I wrote down the 108,000 meals will not be served. What? Where did the funding cut happen? That's what the only thing, not the only thing, but it's one of the things I'm concerned about is, are we like coming back to a thing that we sunset, or what's happening?
Mr. Fisk.
Sure. Some of that funding was from the dollars from COVID kind of being completely gone. So we're kind of getting back to pre-pandemic levels of funding for senior dining. However, we have a lot more seniors that are now in need of that service, and we haven't necessarily figured out how to manage that and how we can meet their needs.
Senator Maye Quade.
Thank you. Sorry, I'm just
Are you looking at the same numbers like I see in 2023? 45,000 people in their community, 389,577 meals.
Mr. Chair, if I may, as Senator Maye Quade, I think is...
You just interrupted the chair.
I'm sorry.
Do you do that in your committee?
It happens to me all the time.
I'm kidding. I'm giving you a hard time. Go ahead. Talk to me.
I'm sorry about that, Mr. Chair. I just wanted to add to what Senator Maye Quade is saying, is that in addition to what Mr. Fisk is saying about depleted funds, there is obviously also tremendous increased need over the past 3 years. If you talk to our friends at Second Harvest, they will tell you that things are a lot worse now than they were during COVID. So I just wanted to provide that context as well, if I may.
And it doesn't surprise me because one of the counties, you remember last year we helped pay the bill for one of the counties that owed DHS like $300-some thousand. Senator Rodkey, that was Todd County. I mean, that was one of them, and that's in that kind of that regional thing. So once again, here's a need. What are we going to do about that, right? Sad. I was only trying to be funny, but my wife. So. Senator Maye Quade.
No, I appreciate it. Thank you, Mr. Chair. Yeah, it's a need. Groceries are really expensive, getting more expensive. People are aging. I mean, I will not tell you how old my parents are. They absolutely could cook for themselves every day. Do they? No, they don't want to. They did that for me and my brother for all those years. They're not interested anymore. And it's communal, it's, community too. And so I think this is just really important. And I appreciate you bringing this issue forward and giving us some really specific, I always love specific numbers and being able to put numbers to a need, although this is heart wrenching, but I appreciate you bringing that forward. So
thank you.
Well, and one quick point to add, Mr. Chair, is that because we have a fairly significant food shelf in St. Cloud that we operate, we use food rescue for that food, and if we can use it for senior dining, if we get enough to use through our area, we will actually use food rescue. So we've tried to be innovative to this point, but we're going to have to be able to think of different ways of partnering.
So you know what, to that point, there's people in my life that work in schools, and there's a lot of food that gets thrown out on a daily basis that's not captured, that could be captured into that. I mean, a lot of food that's already prepackaged. So what are we going to do with that? Senator, anything you want to add, and then we'll lay this one over?
Oh, Mr. Chair, I would just say that there's a larger conversation even about within schools of their own food waste that they would like to be able to repurpose, but I think there's some rules, regulations, I don't know if they're state, federal, or both, that prohibit some of that, and when you're mixing kids with seniors, you want to be careful.
Thank you. Senator, thank you very much. We're going to lay this thing over for possible inclusion into our omnibus bill. I appreciate the work. Thank you for coming down. See you. Senate File 1789, Senator Gruenhagen. You got the Minnesota Board on Aging. Look at, we're ahead of time. You got Maureen Schneider, Chair, coming down. She's on the Zoom-age. Paige Johnson, Senior Linkage Line. Are you coming up, Paige? No. And then Rena Shetty, Executive Director, just questions only. So you're all by yourself, Glenn.
Yeah, I'm used to that.
You want to go, Senator Gruenhagen? I don't know. You don't have A1. No, we're good. Senate File 1789. The floor is yours, Senator.
Oh, thank you, Mr. Chair and members. This bill comes from the Minnesota Board of Aging. There's also a letter inside that kind of highlights some of the principles behind the bill. It basically has to do with the senior linkage line. I'm quite familiar with the senior linkage line. In my insurance agency, we have about 350 to 400 Medicare supplements, and it is invaluable helping people during open enrollment, during the Part D drug plan, or answering questions as far as the price of medication and which drug plan they should use to best cover the medications they have. I've used them for probably over 20 years. According to the information I have, in 2024, just to show you how helpful it is to seniors, they save seniors on prescription drugs $4,361,711 on their prescriptions. I've had seniors come into my office that had tears in their eyes because they couldn't pay for their prescriptions. And once that we connected on senior linkage, thank you. I always need a lady next to me. It makes me look good. Okay. So it's been invaluable to help seniors and to help them find the best price for their drug. It also connects them to manufacturers, so that a lot of manufacturers, if you have a very expensive drug, have programs, depending on your income, you got to fill out some forms to pay part or all of the prescription drug for a person. And so again, I've dealt with them for over 20 years. Now, if you look at the bill, there is a fiscal note, 1.995 million, 26, 2,071,000, and 27. A lot of it has to do with a new federal requirement that I will let my testifier, Ms. Maureen Schneider, address. As you can see, 18 additional staff positions for area agencies on line 1.16. With that, I would like to have Ms. Schneider comment.
Maureen Schneider's on Zoom, and then Rena, you're just going to be hanging out if we got some questions, right? Sure. Thank you. Ms. Schneider, can you hear us?
Yes, I can hear you. Can you hear me?
I can hear you. We can see you. Welcome.
Thank you very much. Good afternoon, Chair Hoffman, members of the committee, and thank you, Senator Gruenhagen, for introducing my discussion points today. I'm happy to be here with you. My name is Maureen Schneider, and I am chair of the Minnesota Board on Aging. I've also served as a family caregiver for multiple family members, and I'm also a former board member and volunteer for a hospice organization. I reside in Greater Minnesota, and I've worked in the field of aging for 35 years. And Senator Hoffman, I took down what you just said a bit ago, because it just spoke so much to me. You said your committee enjoys the work you do because it's real. And as Senator Gruenhagen already has spoken to you, the senior linkage line is real. It is a free service. It's a statewide service, a service of the Minnesota Board on Aging in partnership with Minnesota's area agencies on aging. And the Minnesota Board on Aging is the primary organization for aging in the state of Minnesota. We are the federally designated state unit on aging. And we have brought good value to Minnesota's elders for many, many years. And we want to continue bringing that good value forth. And one of the ways we do it is through our senior linkage line service. Senator Gruenhagen already told you a couple of the statistics, but I'm going to tell you a little bit more in support of Senate File 1789, because this is really about making a targeted investment to strengthen the Minnesota Board on Aging's ability to meet federal requirements, expand our service area, and ensure that we can continue to meet mission of having Minnesotans being able to thrive, age well, and live well in their communities. I'm not going to take up our time going over any additional aging demographics because the committee clearly has a strong grasp on what is happening with aging in the state of Minnesota. What I do want to say is that the Minnesota Board on Aging, through its Older Americans Act programs, serves and reaches with our programs 1 in 5 Minnesotans and our caregivers and their caregivers, excuse me. So let me tell you just a little bit about the senior linkage line and why we are here with our proposal today. This is 2024 data. It's quite current. In 2024, the senior linkage line received just over 122,000 calls. We answered 70% of those calls received. 150 calls a day are abandoned every day, and that's mostly due to long waiting times. People get tired of waiting and they hang up. In spite of that, our approval ratings from a post-call survey are at 94%. You know about the dollar savings on the prescription drug costs, and that came out of the Medicare open enrollment, which takes place every year. This year from last year, in 24, from the 15th of October to December 7th. We received on the senior linkage line an average of 699 calls per day. And that was peaking at almost, well over 1,200, almost 1,300 calls a day. 63% of those calls got answered. That is not what I would like to see happen. I've often thought about, because of the popularity of senior linkage line, and because we have a national reputation as being one of the finest information and assistance lines, I have thought maybe we should do some more marketing for the senior linkage line. But I don't dare, because all that would do would be increasing the call volume, and we already aren't able every time to answer every call. Why are the call volumes up? Well, of course, it's part of that Medicare open enrollment, but it's also because the callers' questions are becoming more complex. They take longer to answer. So I am hoping that we are able to move forward to build up that service so that it can continue with the excellence that it's enjoyed for many years. And as I said, this national reputation. The other thing that has happened is the Minnesota Board on Aging, as the state unit on aging responsible for administering the Older Americans Act dollars, we are subject to the federal final rule on the Older Americans Act dollars. And the release of a new final rule came about in 2024. And it hadn't been looked at since 1988. And so what is going to happen here is that we are going to need to ramp up in our administrator role to make sure that our policies are in compliance with the new federal rule on Older Americans Act dollars. And not only the board will need to do that, but our 7 area agencies on aging across the state of Minnesota will also need to be brought into compliance. We don't have the administrative bandwidth to do that job with the degree of excellence that we want to bring to it. So that's the other part of our request here. I should also tell you that that final rule has 56 policies in it. And so it is going to be, and has already started to be, a major undertaking, and we simply must get it right. So that is a little bit about what we're here for today. I will certainly take questions. Our Executive Director, Rena Shetty, is here also, along with other staff members. If you have questions, please let us know, and we'll be happy to take them. Thank you again for your ongoing support of the Minnesota Board on Aging and understanding that we provide very good value for Minnesota taxpayers.
Thank you, Maureen Schneider, for giving us that information and background. Maureen, when's the last time you guys did your state plan? I think on the OAA, you're supposed to do it every 10 years. I guess I wasn't listening. Did you say when's the last time you guys did your state plan?
We updated it in 2024, and it runs through and is effective through the end of 2027.
Okay, so you did a 3-year extension on that. Okay, Senator.
Oh, yeah, thank you, Ms. Schneider.
Wonderful.
For that testimony.
Yeah.
But my question to Mrs. Schneider is, or whoever can answer it, is the number of FTEs, the additional staff, is that scalable based on the circumstances that you explained as far as the senior linkage, or is it absolutely you want to stick to the 18 staff positions?
Yeah. Rena Shetty, do you want to, is that something you can look at? I mean, I would assume it's all scalable. Senator Utke, I mean, we've had that discussion. So when you're looking at needs, because there's an unknown too, you might want to ask, what's your part of the aging, that act, the OAA, if I got that right, we don't know what's happening there. I mean, it's a federal, and if you can't answer that, you don't know, then don't feel like you have to answer that. You need to know. But that's an update, I think. Ms. Bailey, we're going to ask about the unknowns. What does that mean for Minnesota if X, if Y, if Z? That was a question that came from this committee. So go ahead, Rena.
Thank you, Senator, members of the committee. So the Board on Aging is asking for 4 FTEs, 2 for the administration of the Older Americans Act and to get into compliance with final rule, and 2 FTEs to oversee the senior linkage line operations. The other 18 is staffing that will go to the area agencies on aging, most of whom are in greater Minnesota. So is it scalable? Everything is scalable and modifiable.
Is that helping, Glenn?
Yeah.
All right. So members, Glenn, we're just going to lay this one over too, and let's go figure out what we're going to do here. Thank you for bringing another need. We knew the silver tsunami was on its way 13 years ago, 12 years ago, and it's here, and now we got the needs that are in there, and the Board on Aging is absolutely, thank you, Ms. Maureen Schneider, for all your volunteering and your work on that. Thank you, Glenn.
My only request would be that when you lay it over, lay it on top of the pile, okay?
You hear that? That was good. That's a good one. We're going to lay this one over on top of the pile there. So thank you, Glenn. Senate file 1925 be laid over possible. Wait, no. It's Glenn's. It's 1789. Sorry. Wednesday, Miss Elise Bailey is going to talk about some of the stuff we should be having in front of us, the unknowns. What does it mean? We are in an unknown, right? Some of the federal payment issue discussions. So bring your thought process on the what ifs. Senator Abeler, yeah, that's a good, yeah. So it's going to be I think that's all we have is Elise and Christy, right? So bring your hats. Thank you, everybody. Enjoy your day. We are adjourned. Look at that, Senator. Yes, on time.